Hello, I'm Jonathan Mast, and welcome to this edition of the Sedgwick Podcast. Today, we are going to be talking to Beth Burry, Managing Director, Managed Care for Sedgwick, and Joe Copeland, Senior President, Product Design and Strategy with the Managed Care Group at Sedgwick. Thank you both for being with me today.
Thanks, Jonathan, for having us.
Yeah. Thanks very much, Jonathan.
And we're going to be talking about a topic which I've been working on getting the title out here, but we're going to be talking about clinical care guidance for navigating musculoskeletal injuries. I got it. So before I have to say that, well, I have to say the word again in the first question, but we're going to start with you, Beth, and then jump over to Joe. What are some common challenges faced by workers with musculoskeletal injuries?
Yeah, of course, Jonathan. And just as complicated as the word is to say, I think that these injuries for musculoskeletal disorders are oftentimes some of the more complicated ones that we see in workers' compensation, but then also, generally speaking, and I think it's really interesting just for our audience to realize, throughout the globe, musculoskeletal disorders are ranked in the top 3 disabilities amongst non-communicable diseases. And so basically that means that there's a tremendous amount of these in the population at large, but it also means that there's a significant loss in productivity, and performance can be greatly impacted, especially when it comes to injured employees in the workplace. So we think it's important to pay attention to these just for the sheer fact that they're so common. And interestingly enough as well, according to the Bureau of Labor and Statistics, musculoskeletal disorders account for about 30% of all workers' compensation claims. So we're talking about a very significant number of individuals who are impacted by these on an annual basis. And certainly we realize that the injury types will vary, but within our data set, we realize that about 25% of shoulder-related claims had a surgical intervention. So on top of it being a musculoskeletal injury, which can be complicated to treat, 25% of those that were shoulder-specific actually had an intervening surgery. So I think it's really key for us to focus on these types of injuries because of how common they are, how expensive they can be, since we know that surgical claims can sometimes end up being almost 10 times as expensive as non-surgical claims. And so we want to look at ways that we can address these within our program. And oftentimes we found that traditional approaches just aren't enough. Even within the provider community, they often will admit to a complicated process, complexities during recovery, and not actively engaging the injured employee in that process and their return to work journey can lead to really poor outcomes. And we believe we can do it better.
Yeah, Beth, you raised some really, really great points. And, like you said, they're common injuries, but I don't know that we can expect to see a sort of cookie-cutter treatment path that we've talked about in the past. The impact of these injuries can be as different as we are as individuals. That means some people may feel a more pronounced ripple effect because they suffered an injury. Their care is fragmented, and they just don't understand how they'll ever get to recovery. And so in those instances, it can be easy to feel stuck in a cycle of pain and frustration. And I really think that's a relatable human challenge. But it also creates a business challenge for employers that I think are kind of unique with these kinds of musculoskeletal injuries. And if I, draw from the concept of a Venn diagram, there's this critical overlap where the interests in recovery converge for all of the stakeholders in this system. And so it's in that intersection that I think meaningful solutions can be found that benefit both the employee and the employer. So I'm really excited to have this conversation.
All right. Well, that was a great kickoff on question 1. Going to the next question, how do we use technology to identify claims that can benefit from clinical intervention And how can that tech empower us to manage and treat musculoskeletal-related claims? Possibly, Joe, if you could talk about AI guidance and predictive modeling.
Yeah, of course. So to my point earlier about not all recovery looks the same, finding those claims where a clinical intervention will have the most impact is crucial. Because not every case is the same, that's where technology can help. Technology by itself is not the answer, let's say that, but it is definitely a key part of the equation, especially when you think about the complexities of healthcare, the complexities of workers' compensation claims, and the volumes of information that comes through on a claim. I mean, if you think about it, there are over 69,000 diagnosis codes and over 10,000 CPT or billing codes. You've got notes from medical visits, you've got notes from examiner conversations. There's all this rich information that we can use to be more precise in how we deploy the right resource, the right clinical resource on the right claim. But it really is, a little bit too voluminous for humans to be expected to synthesize that with any high degree of accuracy or confidence. And so we use AI care guidance to help support the examiners in finding the right claims that would benefit from a clinical intervention. So like I said, not all injuries are the same, not all injured workers are the same, not all recovery paths are the same. So the first step is identifying the right claim. AI care guidance is really exciting because it's a groundbreaking tool that's really transformed how we approach finding claims. The model is called analytical AI. So what that really means is it uses AI to analyze data so we can uncover insights that might be missed because of the volume of information that comes in on a claim every day. Essentially, it provides predictive analytics, which means it anticipates the progression of a recovery so that it can identify patients who might be at risk for delayed recovery. And it uses the breadth of our claim, outcome, and medical billing and treatment data, as well as structured and unstructured data, which are those notes that I referenced that have all that rich information that could really inform the model. It also provides decision support. We don't take humans out of the equation, and I just can't put too fine a point on that. What AI care guidance does is it provides the examiner with a claim it thinks would benefit from a clinical intervention, and then it gives the reason the model identified the claim and offers a recommendation to the examiner on whether that should be telephonic case management or field case management. And really all of that's designed to optimize the outcome. It runs every 15 minutes, so it's looking at data almost real time so that we find the right claims faster. We get the injured worker the support they need sooner, ideally before that feeling of being stuck sets in and before, any level of chronicity. And so if I could sort of, put all of that word salad in a box, I summarize it to say that AI care guidance is a predictive model that helps us to make faster, more informed decisions, but it does not replace human judgment. Using the concept of the intersections like I used earlier, it really is the intersection of technology and human compassion, intellect, and reasoning. And we think that is the recipe for revolutionizing how we identify the claims so that a human can determine what is the appropriate path.
Well, staying with you for now, Joe, building on that, what types of data are most valuable and how do we collect and analyze it? What are the benefits of our data being in-house?
Yeah, really the value of data is determined by its relevance, its accuracy, and its potential to drive decision-making. Those are sort of the three criteria to say, is this data going to be valuable in the model that we're building? So at Sedgwick, we have all the claim information and medical data in-house. And that means we have all the relevant data that we need to create a holistic view of that injured worker. And that really is how we identify what we think are the right claims for a clinical intervention. And like I said before, the model looks at unstructured data where information exists that could inform a model, but it's not in a table that's easily consumed. And so the ability for the model to look at those notes and those things that are kind of free form, it really expands our ability to be more precise in how we identify those claims. And so all of that just adds to the credibility and the accuracy of the recommendations from AI care guidance. And then, the holistic view of the person along with that model highlights that the consideration of what claim is identified is driven by faster decision-making that helps get us to faster action. I know I've said this twice already, but I just want to underscore it because it's so important to highlight that we don't take humans out of the actual decision-making. Because we have the data in-house, because we have our examiners and nurses integrated, the clinical strategies that get deployed on the claims are also aligned with the claim objectives and the claim program objectives. And that's crucial to making sure that you're delivering something that drives value for the injured employee as well as the employer. And so, having a model in-house, developed in-house with the data in-house gives us a couple of things. One, data security, and that's not a small thing. We're not sharing data with a third party, and so we have everything is housed in our secure environment and stays there. We get greater control and accessibility, so that means we have immediate access to crucial information so that we can make quicker decisions and be more agile in responding to needs as they change. And then finally, integration. The model and its output is integrated within our existing processes and tools, and it can be customized based on evolving needs. So I think the differentiator is having all of that data and keeping it enclosed in our secure environment.
And Beth, how do we ensure that the interventions are tailored to the specific needs of each injured worker? How do we address their holistic needs, for instance? And then what factors do we address throughout the process, for instance, referrals or ancillary care coordination?
Yeah, absolutely, Jonathan. So as Joe mentioned, our entire clinical model is designed based upon having a human intervention. And as she mentioned, our data is super valuable, but really it is the next steps, the interventions that our specialists and our clinicians or case managers are going to take that allows us to tailor that particular injured employee's recovery pathway. And so really where it starts is assessment tools, right? So understanding some of the psychosocial barriers, if there are behavioral health concerns, social determinants of health, we can't ignore those. Those are really important when it comes to how and what the injured employee's perceptions are going to be about their recovery, their treatment plan, how they're going to feel about the compliance that's necessary to ensure an optimal recovery, and making that accessible and as easy as possible for them, right? There are also a lot of comorbidities that we have to consider, especially in the area of musculoskeletal claims. So we need to look at all of those factors as we are establishing and continuing to refine that recovery pathway as the injured employee is progressing. I think also critical, we talked about the importance of surgical claims being addressed specifically. Within these models, we want to ensure that the right resource assigned is going to address things like we call prehab habilitation. And that means that we're getting in front of surgical procedure, we're having conversation with the injured worker prior to surgery, preparing them both from a medical, a nutritional, a psychological perspective. What can they expect during and after their procedure? And then ultimately ensuring the right post-surgical care. And we'll use a lot of tools and resources during that process. You mentioned ancillary care coordination, which is critical post-surgical cases. They need to have the education and the resources available, when you're having to change a wound dressing or you're having to put a sling back on your arm. I mean, all of these things are not typical for most people, and so having the right individuals who can interact in a very caring and compassionate interaction with the employee at that time is really going to help them as they're recovering right after their surgery. Part and parcel to all of that, be it surgical or non-surgical musculoskeletal injuries, you're probably going to have pharmacy involved. So prescription medications that might be prescribed by the provider. We want to make sure that those are safe, that the employee understands how to take these and to obtain optimal benefit from them, and that there are no adverse reactions. We want to make sure that if in fact they do need to have a prescription post-surgically, that they know how they need to be taking these medications and that these aren't long-term medications either. In terms of physical therapy, I mean, that's really potentially going to be one of the first steps that an injured employee may take to recover from a musculoskeletal injury. And we have experts on our clinical team who will be available to evaluate physical therapy notes, have peer-to-peer discussions. So our physical therapist is able to call out to the treating physical therapist to have discussions so that they understand what the treatment plan is, but they also can make solid recommendations, right? And then I think, obviously, part of this too is getting the right qualified medical practitioners. And I think, within our 4- and 5-star provider benchmarking, we guarantee that these are qualified and really expert practitioners. They have the best outcomes possible, and we want to direct care to those individuals so that injured workers can feel that they're getting the best experience possible as they're recovering.
What does a patient-centric approach mean to you, and why is it important? And we'll start with Beth, and then we'll go to Joe to answer that question.
Sure. Well, I think that, first of all, for many, many years, we've used the term patient-centric to describe our approach in healthcare. And it's a widely used term in both medical, insurance, claim settings, and it really is about meeting the employee where they are. And it's an advocacy-based approach. But I think that while we can throw around these terms and talk about it, what really needs to happen is putting it into practice, and that means customization of recovery pathways for the injured employee. So I think Joe said it earlier. It isn't a one-size-fits-all approach. It's not cookie cutter. You have to understand the nuances of that individual. Like I said, the different characteristics, psychosocial, social determinants of health, comorbidities. What are their goals for recovery? What does their return to work situation look like? And while we really value and we need guidelines like the official disability guidelines, for example, these are ballpark measures that ultimately have to be customized for each individual. So what we really need is evidence-based practices that are married with aligning the individual with their specific needs to get a comprehensive care plan outlined.
Yeah, the only thing I'd add to that is really, I think AI care guidance, helps us find the right claim, and then the clinical care guidance or the pathways that Beth was referencing helps us chart the right care path for that individual. And I really think it's that fusion of innovation and empathy that keeps the injured worker at the forefront of the approach that makes it patient-centric, and I think that that's super important to get the kinds of outcomes that we would expect in terms of recovery and return to work.
All right. Well, as we wrap it up, Joe, any other takeaways as we gear up for the National Comp Conference, things that we should be thinking about from either you or Beth before we say goodbye?
Yeah, I would just say, as you're preparing for the conference, think about how musculoskeletal claims impact the business today. How might they look in the future when you layer in an aging workforce, and think about how future-proof your program is. And if you have any questions about how future-proof it is, then I think the kinds of solutions that Beth was talking about are really critical to be part of, what your roadmap looks like in the future on how you manage these kinds of claims.
Yeah, Joe, I was going to say, I would just add to that being that we're all going to be in Las Vegas, don't gamble on the right approaches to your musculoskeletal claims.
I
think that so that maybe that's the takeaway. But I think there are going to be a lot of great presentations. I've looked through the agenda that they have ready for us in a few weeks, and there are going to be lots of various aspects talking about claims management and recovery. I think just keeping in mind that every recovery is unique, and just paying attention to some of these tailored approaches that we've talked about are really key. And, I'll be there, as will be Andrea Buell, our president of managed care, Dr. Teresa Bartlett, our medical director. We're going to be there to talk about these types of issues and how we're addressing these challenges within musculoskeletal claims. So we really look forward to it.
Well, Joe and Beth, thank you both for being with us today, and great information. And, what's the over-under on musculoskeletal being mentioned during National Comp? I think that we're going to stick with the gambling theme, but yes, two great resources. So if you're at National Comp in Las Vegas, please be sure and catch one of our Cedric experts. And until next time, thank you for being here.